What are Hounsfield units in liver cord scans? Imagine a way to measure how dense different tissues are inside your body using just a special kind of X-ray. That's what Hounsfield units are all about. They are a standardized scale used in computed tomography scans, or CORT scans, to tell us how much X-ray radiation tissues absorb. Every tiny part of a CORT image, called a pixel or voxel, gets a number based on its density, and these numbers are called Hounsfield units. The scale is set so that water is 0 Hounsfield units. Air, which is very light, has about -1,000 Hounsfield units, while dense bone can go over 1,000 Hounsfield units. This scale helps radiologists see and tell apart different tissues and spot abnormalities. In liver scans, Hounsfield units are especially important. They help doctors understand what's happening inside the liver. Normally, a healthy liver on an unenhanced CORT scan has Hounsfield units between about 50 and 65. If the liver has a lot of fat, the Hounsfield units tend to be lower because fat is less dense, usually around -80 to -100. This can indicate fatty liver disease, which is common and often linked to obesity or diabetes. On the other hand, higher Hounsfield units in the liver might mean there is fibrosis, inflammation, or tumors. These differences help doctors figure out what kind of liver problem might be present. Hounsfield units are also useful for looking at liver tumors. Different types of liver masses have characteristic Hounsfield units, especially when contrast dye is used. For example, some benign cysts or hemangiomas might have very different readings compared to malignant tumors. By measuring these values before and after contrast is given, radiologists can better identify and classify liver lesions, which guides treatment decisions. It's important to remember that the accuracy of Hounsfield units depends on the calibration of the CORT scanner. Modern machines are regularly checked to ensure their measurements stay consistent. Still, slight differences can occur between different scanners or settings. That's why radiologists interpret Hounsfield units along with other imaging features and the patient's clinical history. They never relying on these numbers alone but use them as part of a bigger picture to diagnose and manage liver health. In summary, Hounsfield units are a vital part of liver CORT scans. They provide a numerical way to assess tissue density, helping detect fatty liver, inflammation, or tumors. These measurements are a key tool for diagnosing liver conditions, monitoring disease progress, and planning treatment. If you have concerns about your liver health or are undergoing imaging tests, always consult with healthcare professionals who can interpret these results in context and guide you on the best next steps. Remember, every person's body is unique, and medical decisions should always be personalized and based on comprehensive evaluation.